cloud. So I did that. I'm just going to share my the agenda very quickly so people have that. So I'm sharing that right now. And I think we'll begin. So I will start with introductions. I'll start with myself. My name's Dana Hillier. I'm a psychiatric nurse practitioner here in Helena, and I'm one of the co-facilitators for the Maternal Mental Health Task Force of our ECC of Helena. So, all right, I'll let somebody else jump in.
I'm Bree McLaurin. I'm the Executive Director of Healthy Mothers, Healthy Babies, and we are a statewide nonprofit focused on pregnancy and 0 to 3 ages, but really involved with this task force.
Let's see.
I'm Jacqueline Isley. I am the Community Health Promotion Division Administrator with Lewis and Clark Public Health, and I am part of the Maternal Mental Health Task Force as well as the leadership team for the ECC and the 0 to 5 Early Care and Education Task Force.
And we'll go with Emily.
Hi, I'm Emily Cluis. I am with Healthy Mothers, Healthy Babies, and I am the Program and Communications Coordinator. New to the team, and I'm excited to be here.
And I can, let's see, we'll go with, I don't have your name again. I apologize. I'm very bad at names. So from Legal Services.
Yeah, sure. My name's Harley Brown. I'm the Health Justice Project Coordinator at Montana Legal Services Association. Essentially, I'm working with service providers to get them information on social determinants of health issues and how those intersect with legal aid and educate folks on legal aid. So I'll talk about that a little bit more in my update.
And I believe I don't see her face, but we have somebody from Great Falls who I've been talking with about our task force. Christina, do you want to introduce yourself? And I don't know if you have the ability to be on screen video.
Not today, hopefully in the future. So I'm Christina Winger, and I'm just a LCPC over in over in Great Falls, and I was just reaching out due to some interest in maybe creating something over here, a resource, just because we have quite a few people, but we don't work together yet, and it would just be nice to see kind of what you guys are doing. So I'm glad to be able to join and just see how you guys do it over in Helena. So.
All right, well, thank you and welcome to our group, and you're welcome to come at any meeting you want to. We're happy to have you and happy to help you with your efforts in Great Falls. So I'll just quickly review the agenda. Then I have a quick question to ask everybody to sort of loosen us up for our big discussion today, but we'll do some brief updates, find out where things are going, if there are any good stories, and just remind us of the quarterly task report that's due at the end of the month, and then we'll jump right into our project work. So my question today is, what's your favorite place to visit in Montana? So I guess I'll start, and my favorite place is Yellowstone National Park. That's always been the first place I ever came to in Montana was the park, and I still go there as often as I can. So I'll let somebody jump in. Anybody else have ideas of where they like to go?
Yeah, I'll jump in real fast because I didn't speak up earlier. And I'm Megan Peters, by the way, the VISTA, you're fine, the VISTA for the Early Childhood Coalition. And I think my favorite place so far, the place I've gone to most regularly in Montana is Glacier, but I think I obviously have a lot more places to continue to explore. And I'm going to Yellowstone this weekend, so hopefully that tops the list as well.
Okay. Somebody else.
Let's see. Yellowstone is definitely toward the top. I guess growing up in Livingston, I don't think of it as a place to like visit necessarily. because it was always so close, although now it's farther away. But I would say Flathead Lake for me is one of my favorite places to spend a chunk of time.
All right. How about you, Bree?
Mine, I think my favorite Montana spot is the Missouri River. The stretch between Wolf Point and Craig, I've spent many glorious adventures growing up there and now as a grown up. So.
Okay. How about you, Harley?
It's hard to pick a favorite, but I've done some backpacking in the Cabinet Mountain Wilderness a couple of times and went over 4th of July this weekend, and first time back in a few years, and it's very beautiful up there.
It's a place I've always wanted to backpack, so maybe one of these summers. How about you, Emily?
Yeah, I think probably my favorite spot to go is Flathead Lake. My husband and I got married there, and it's just a really special place. There's a small state park on like the northwest end, and they have this pier that goes out into it, and we love going up there every summer and jumping off. And yeah.
Okay. How about you, Christina?
Oh, it's difficult to kind of pick just one. My girls and I did a lot of exploring during COVID because we couldn't go anywhere else. So we went outside. Somewhere fun that we found was Big Timber, and we went over the natural bridge. So that was kind of fun, just exploring. So yeah.
Okay. I see that Pam joined us, so I'll let you introduce yourself, Pam. And the question that we asked is, what's your favorite place to visit in Montana?
Thanks, Dina. This is Pam Ponich from Addictive and Mental Disorders Division and private practice as a therapist in Helena. You guys all know that. So I figured what you guys were talking about. Sorry, I was on a really dry, horrible SAMHSA webinar, so I was glad to escape to come here, but that's why I was a little late. My happy place in Montana is Swan Lake. And when I was 24, I actually put a down payment on a piece of land on the lake, and now have a little mini cabin. I call it a cabinet, right on the water, and it's my favorite place in the world.
Okay. I think we have a couple of other people who have joined us. I thought I saw some, but I didn't see who came on. Is there anybody else?
There are some chats from Robin. It seems like she might have trouble with her microphone.
Oh, okay.
But Robin Souser's online, the EMS for Children program, and her favorite place is the Bob Marshall Wilderness area.
Okay. All right. Okay. Well, I hope Robin's able to get her microphone working. Was there somebody else who came on? I'm only seeing a few people, so I don't know if I can expand this to see more people, but anyway. There's anybody else who hasn't spoken here and is on the call and wants to say hello, please do. And otherwise we'll get started so that we can get to work. I guess the first thing, are there any updates that anyone would like to share?
I can do a quick update. Our conference the registration is still open, and it's slow this year. Last year we sold out. This year we've barely sold tickets, which is unfortunate. We did give away quite a few registrations for sponsors, but I can share more info in the chat. I'd love to have you spread the word. And if anybody needs a scholarship, please reach out. I can make that happen. We had a change in the agenda yesterday. I'm feeling a bit frazzled as I've been multitasking to fill in the spot, but it's turning into a beautiful plan that was actually part of the original vision that couldn't come together before. So we will be debuting our documentary short that was made by Melissa Bangs and a group of Indigenous women from the Flathead and Northern Cheyenne reservations, called Our Stories Are Our Healing. And then there will be an Indigenous perinatal mental health panel to end the conference. So that is really exciting new development and will be a really important addition. And also we were just able to add a colleague of Gabrielle Kaufman out of Maternal Mental Health Now. She's a Black woman from LA, and she'll be presenting with Gabrielle. So our lineup just got a lot more diversity, which I'm really excited about.
And I wonder if people, I mean, I am planning to go. I just haven't registered, Bree. Don't worry.
Christina, I've been looking for you.
We're going to come, but I'm just wondering with the virtual stuff, if people are just, that's kind of like last minute. They're going to come, but they haven't started.
I hope so. Yeah. And I know people are tired of being on their computers too, but we're going to have a playlist, and there will be dancing.
Okay. All right. Sounds good. All right. Well, I promise this weekend, Bob and I are planning to register for the conference. That's on our to-do list this week. So, okay. Anybody else with a good updates for the task force?
I wanted to just plug a few programs Montana Legal Services is doing that might impact families you're working with. So one that we just launched, we got CARES Act funding from the Department of Commerce, and that's a Montana eviction intervention program. So MLSA got funding to pay private attorneys to represent clients who are facing evictions. There's no income requirement on that. And as long as there's an eviction that they've been served with, or in some cases, say the landlord won't file an eviction, but is harassing a tenant or something like that, we see quite a bit of that. We will represent them or have a private attorney that we've done an agreement with who will represent them. It's a pretty amazing program that we're able to provide full representation for families. I'll put how to apply for legal aid in the little chat box for the Zoom call, along with my email if people have questions about that. I'm also going to plug Montana's emergency housing assistance program through the state, and that's with that emergency rental and mortgage assistance money that was passed through the CARES Act. So that has a lot higher income requirements, so probably most families in Montana would qualify for it. We're on those biweekly calls with NeighborWorks Montana, who's helping folks apply for that money. So I'll put NeighborWorks info in the chat box as well. They'll help walk people through the application process. They also flag people who are having issues where their landlord might not take the money or might be doing illegal or kind of shady things, and refer them to MLSA. And then we also have a website called Montana Law Help, and it's kind of just some basic legal information. We have a COVID specific page that lists what protections exist for renters and homeowners during the pandemic. So I'll put that in there as well.
All right, thank you. All right, anyone else? Dates. Okay. I'll take that as, I don't know if anybody, I know that Robin was having trouble. I don't know if she has any updates. How about good stories? Anybody have a good story? Oh, goodness. I don't even right now. It's been a crazy week, so I can't.
I was going to say, Dana, and I can't remember, honestly, if I gave this update here to this group or not, but we did get word from the feds that WIC can continue to provide benefits remotely through the end of the declaration of the emergency. So that state of emergency is reassessed at the federal level every 90 days. And WIC is guaranteed to be able to serve remotely through the duration, which is great to be able to continue to get families benefits without risk of them having to come into the office. And we didn't know that was supposed to expire at the beginning of October. So that's good news.
Okay, that is great. Good news. That's a good story. Okay. All right. Anyone else with a good story or update or?
Well, I don't want to put Emily on the spot, but I think that Emily joining the HMHB team is a good story. She is has many talents, but is really, if you want to kind of introduce yourself and kind of what your work's going to be with us, I think that would be great, especially talking about your, like, the mama vision.
Yeah, absolutely. Thank you. Yeah, so I started HMHB probably 3 weeks ago now, and kind of trying to dive right in. Really excited to be a part of this maternal mental health task force. Some of the things that I'm going to be helping with is creating the resource guide, and I feel really, really lucky to be able to do that. We had one of our first meetings today about kind of like planning our execution, and I'm just thrilled. I think that it's going to turn out really well. Another vision that we kind of have is trying to find a way to connect with mamas in the community directly, to kind of strengthen that ability to bring those resources directly to moms, but also to receive feedback about what moms in the community are going through and what they're experiencing, especially during this time. So we've talked about taking our branch of HMHB right now is Mother Love, and that's centered a lot around our podcast, which Claire runs. And if you guys haven't checked it out, it's so beautifully done. It's really, really good. And kind of using that storytelling piece and that connection piece and really extending that to the community. So we have some plans that we're building for social media, to maybe create like a hub or a group or something like that to reach out to the community directly that way. And I'm pretty excited about that, and just kind of building community, especially in this period of time where we're all online.
Okay.
Yeah.
Well, welcome.
Thank you. Thank you.
Yeah, we're excited to have you, Emily. So,
Thank you.
all right. Anyone else? Okay. I think what I'll do is just jump in that Christina and I are going to meet tomorrow morning, and we will be reviewing what we need to put in for the quarterly report. So I don't think we have any needs from the task force. Christina has done a really good job of putting together the quarterly reports up to now since the first of the year. So we're just going to review what we've done over the last 3 months to make sure we have what we want in the report. But so that's where we're going to start. So I will now, I'm going to stop sharing this screen. Yeah. So hopefully that I'm done that. So, whoops. And I'm not sure what I did, but maybe. Okay. I have let everyone share the screen that they want to share. So here, I know there's what I did. So I think Bree will start with the agenda item, which Bree and Megan were going to give us an update on the peer support projects we're working on and where we are with things. So I'll let Bree and Megan take that over, and then Bree will start our discussion on strategic and values-based decisions. So take it away.
Okay, cool. So Megan, I don't know if you want to lead this part and I'll do the next, or if you want me to just kind of babble and you can back me up. Babble. All right. So so there's the funding that DPHHS got to work on preventing substance use is a really robust amount of funding that's doing some really cool stuff, run out of the trauma systems. Maureen Ward's the leader of that ship, and she and her team are upstream thinkers, and they are seeing how maternal mental health and early childhood tie into preventing later substance use, and are intentionally trying to take a 2-generational approach to preventing later substance use in Montana. And so they've been a great partner of HMHB and many other organizations, and they recently opened up an opportunity for some mini grants, and I wrote for one and got it. So the mini grant will fund 6 months of HMHB staff time with Emily, working 10 hours a week on the resource guide, which should, really help. And then with Megan's attention too, we should be able to get a lot done, but we'll move into the resource guide topic next. But another piece of it is peer support training. And so for a long, long time, we've been talking about peer support in our community, and recently attended in-service offered by Group Peer Support out of Massachusetts. And many of us thought, wow, that sounds great. And so I, at the last minute, upped the grant ask and to include group peer support training for 5 peers in the county, and they accepted that activity as well. So with that, Megan and I, led by and guided by a group, I guess a subcommittee of this task force that meets every other week on Friday morning to talk about peer support locally, and tying in with state initiatives as we're able, are kind of helping us figure this process out. And so there's 5 slots, and we figured before we even open it up, we should come up with some criteria and kind of imagine who we'd love to see in these roles. And so Pam Ponich was great about kind of envisioning this whole systems-wide approach, because if we want to tap into the peer support, the certified peer support system, we need the peer support folks to be supervised. So we thought a licensed social worker or mental health provider that we could somehow wrap into this vision would be good thinking. We also know that there's capacity within a lot of family serving organizations in our community, such as home visiting or early Head Start, for example, that are already offering groups and family activities. So it might be great to boost their work with this training, since it's not a curriculum of content, more of a best practice and group facilitation with a trauma-informed approach. So we're looking at a couple professionals, I guess we could say, that are working with moms, and then we're hoping to recruit 3 true peers. And so to do that, we have been doing a little bit of research. We had a meeting with Georgia HMHB and learned about some of their peer support work, and that's where we came up with the idea of an orientation. So right now, we're working on nominating individuals in our community that we think might be a good peer, and then inviting them to an orientation. And part of the orientation will be showing them a little video. We're about to schedule a little Zoom interview with Suzanne Bendick from Roots Family Collaborative in Bozeman, and we'll do a little interview and see why she got trained and how it's working in Bozeman, and just ask some questions. And then, we're coming up with a couple other ideas for an orientation, so they know what the expectations are. And after an orientation, then individuals can self-select themselves in by filling out an application. And from that application, then we'll take it back to the subcommittee and make some decisions about how we think we should use the resources. So there's really no reason why we have to train everybody at once. There's some pros and cons of getting people started right away versus letting it happen organically. So we're kind of just going to see what comes out of the woodwork, I guess, and as fast as we can move. I'm also working with Joy Burkhart out of 2020 Mom. I connected with her yesterday and told her about the time. And so there's actually a couple individuals from this cohort of policy fellows I'm involved with that will probably jump into that call that are also interested in this model. So that will be a fun morning. We'll probably have PSI Washington and a couple California folks tuning in to hear a more deep presentation of the 2020 Mom Peer Support Model. That's got a research base too. And hopefully that will inform some folks that have some grant funding to do this work on direction that they might want to go. Also, kind of outside of this task force, but potentially later during session or at some point, sometime, the group peer support accessibility for payment is pretty small right now. And so there's some advocacy points where we could come in as an advocacy community and ask for some changes at some point, but I'm learning about that. And we also probably have to try, and so we can experience some barriers so we can provide some feedback. So Jacqueline, or Megan, Dana, Pam, those of you who are in that call with me, anything else you'd like to add to my quick update? I'm going fast because I want to talk about our resource guide.
Yeah, I think you really did a good job of covering everything, Bree. I think ultimately, whoever is willing to lead these groups, we hope that they will also be willing to commit to at least like a year of sessions so that we can really see how that success goes, and also being willing to share information like attendance and session scheduled and really some numbers so that hopefully that can, like to your point, support any sort of advocacy for group therapy being reimbursed in the future.
I'd just also add that on top of what Bree said, our subgroup is also looking at, what entities we can potentially partner with if that is a need or desire to provide additional specific maternal mental health peer support education. And so Megan's been great about looking into doing a lot of research, trying to find, what other entities are using. And I'm, you guys don't even know this, but just yesterday, I was invited to be a part of a new task force that's actually with Jim Haney of the Peer Support Network. So, and they're looking at what they're calling family peer support. So this was just kind of a different direction from my grant that I'm doing, but I thought it might be a nice conduit to the work that we're doing, and hopefully I can find out more about what's going on with the Peer Support Network and how we can potentially partner there.
Well, I'm really excited. I think there's a lot of momentum that we have for peer support right now, and I think it's moving forward in ways that I'm really happy about, and I'm really excited about, and I'm grateful for all the hard work that everybody has put into it thus far. So I see that, I predict that 2021 will be a good year for peer supports in the community, at least a beginning somewhere. So. All right. Any other comments or thoughts about peer support or questions for Bree or for Megan or for Pam? Okay. Well, with that, I'm going to let Bree take it away. She's going to start our discussion.
Can y'all see the document? Okay, so I'm gonna pull out my cell phone here. Actually we're ahead of schedule, so we've got a little bit more time than we thought. Thanks everybody for kind of pushing through. So we have 16 questions that we're gonna hope to cover over the next 2 months in these meetings, and this is gonna drive this project that has been long in the making to a product. So just as a refresher, in August's meeting, I think it was, I presented this rough draft, well, semi-polished, I guess, draft of a toolkit of a resource guide where we went over the values and the reasons why a vetted resource guide is important. And we as a task force agreed that we would like to create this sort of resource for our community, and agreed that the next step would be to go through this series of strategic and value-based decisions so it can kind of help us with our vision of what this guide will be. So just a little background too is this information came from several years of work early in the start of this task force and working with some other communities and doing national research with other communities that have done these guides. And it helped us shape the kind of conversations that we should be having. So we're all on the same page about what this guide is for, what it's called, what it does, and help us make some decisions. And so my hope is that we spend, well, we have an hour and 20 minutes left. And we have 16 questions. Let me just do a little quick math. I don't know. Let's spend like 7 minutes on each question. Maybe we'll get through more. But so just know I'm going to kind of be rude and interrupt as we get close to the end, just because I care about us as a group, not to cut you off. But I do hope that we can just kind of open up a conversation, and I might just be like thumbs up, thumbs down, neutral. And if there's anything there we need more discussion, please flag me and we can talk through it a little bit more. But it's hard because we're on Zoom, and I'm going to do my best to like not ignore people, but interrupt me if you need to. So I'm just going to set my timer here, and for 7 minutes, and we'll go. Okay, so the first question is, who are we developing this guide for? Is this guide just for moms and dads and parents and their support people? Are we hoping that providers such as OBs or therapists that are working with the parents or the individuals that might be suffering from maternal mental health challenges are going to use this guide? Are we hoping that this guide is, just for people screening, like what, all of the above? If my gut is all of the above, this might be one of those fast ones where you can just do kind of like a thumbs up, and if there's discussion, unmute yourself and let's hear it.
Bree, I was thinking the same thing when I read this question, is that I think that this guide is for everyone. It's for moms, it's for dads, it's for parents and support people, grandparents, providers, people who are screening, home visitors. I think it has to be that encompassing of a guide.
And Bree, this is Sarah Beth. I would echo that, and it might be that we just break it up into different sections. Like if we wanted to have a specific like support person section, or a specific section for people who are screening, maybe with talking points or something for that. But I would agree with that.
Great. Okay. Anybody have any feelings that are opposite or contradictory? All right. Good. Well, we got done with that one. We're doing good.
Hey, Bree.
Yeah.
I did have a thought. I feel like on the 2-pager that there could be a little bit more emphasis on that, that the guide itself is like, I don't know, just giving support people permission to advocate. I think that there needs to be like a little piece about that, like that they have permission to advocate, because I think that could be a barrier.
Thank you. Okay, great. So a next question we want to tackle here is our community's definition of the perinatal period. If you are in nursing school and Google the perinatal period, it's like what, 30, 20, 34 weeks to 6 weeks, but I don't remember, 8 weeks postpartum. If you, it kind of depends on your frame of reference. When we are trained by Perinatal Support International, they're always careful to tell us that when a woman weans, she's at risk for symptoms of her PMAD resurfacing or having a totally new experience. And so I think it's important to talk about this, because if we limit it to 1 year postpartum, some moms aren't screened in that first year and they're suffering in silence. If moms are breastfeeding till 3 and then they wean, they might have an experience. So let's talk about how we feel. The recommendation is the time when a woman becomes pregnant through 1 year postpartum is kind of like the standard that we use in the industry, but there's people that are pushing it farther out, and we should discuss this as a group.
So Bree, I have a very strong opinion that we need to think of this again broadly in terms of extending it to, you know, parents with children 2 years postpartum. Because I mean, I work with a lot of women that have often gone unrecognized for their perinatal mood and anxiety disorder, and their children may be 3 and 4. But they still suffer, and they still had that initial episode of depression or whatever in either pregnancy or postpartum, right after, you know, within that first year, but never were screened, never were treated. So I again believe that we need to think of that, defining the community that broadly.
What do others think?
I totally agree with Dana. And I also, I mean, I think I heard you, Dana, say, you know, recommend up to 2 years. But as we know, some moms are not weaning yet. I actually have a client right now who has a 2.5-year-old still nursing. So can we, you know, if we could define it up to the point of weaning and a year beyond, I don't know. Does that make sense?
And Bree, I guess maybe if we're gonna go with if we decide to go with weaning, it might be good to put language in there for moms who like never breastfeed then, you know, just as like, maybe we leave it broad for up to weaning, but then set some sort of timeline for if moms aren't breastfeeding.
Are we comfortable putting a 2 year postpartum or when weaning? Is that encompassing of non-breastfeeding women? Because they might self-select out, or do we just need to be explicit in our kind of education and awareness that untreated postpartum depression can last many, many years, and then hope the dots get connected? Robin, I'm seeing you unmute yourself, but I can't hear you. Let's see. Okay, Robin, well, I'm watching the chat in case you can type in what you unmuted to say. Sorry, we can't hear you.
Bree, this is Sarah Beth again. I'm fine with that language that you just said, with the like up to 2 years and, you know, or the weaning. Because I just get nervous, like sometimes that dots aren't getting connected.
Yeah.
And so I think, you know, and it might be good, like you said, to like maybe in a different section of this to put the to mention that it can extend longer too. You know, this is just like a rough guideline that we have based on like, you know, the evidence that we have now. But I get nervous with connecting dots for sure.
Okay, so I'm hearing some consensus on the 2 years or until weaning, and we can wordsmith it later. Can I get either you can go in your you can go to participants in your Zoom menu, and if you let's see, how do we do this? Oh, can we?
The
Can we do a
reaction, are you looking for the reactions
Yeah,
button?
do we not have them?
No, it should be in the toolbar. Like if you kind of hover at the bottom, it should say participants, chat, share screen, record, and then reactions.
Oh yeah. If you guys want to give me some reactions here with thumbs up and things like, can you see those? Ah, I see a thumbs up. All right. Thumbs up, sweet. Okay, so I'm getting thumbs up. If anybody has a let's talk about this more, I'm gonna, there's some people on our screens, but if I don't see any, I'm gonna move on and say we figured this one out. Okay.
Bree, it looks like Robin had something in the chat box.
Oh, okay, yeah, thank you. Sorry, is treatment broad enough? Maybe recognizing or question. Robin, I don't understand your question. So we will wait for your reply and then we will circle back. Okay, so what language? Robin, I don't know if you can call in too. I don't know if you have your phone on you, so you could watch on your screen and then call in with your phone. That sometimes works. Okay, so what language will we use? This is one of those ones that when Melissa Bangs and I were at this conversation a long time ago, we never really landed on anything, but I do want to give the example that the Roots Family Collaborative in, oh shoot, you tried to call. Roots Family Collaborative in Bozeman says perinatal wellness. And up in Kalispell, the group was calling on postpartum resources. And so it is really just a Helena culture thing, and we get to decide what we want to call it. We know that perinatal mood and anxiety disorders also impact men. We know that our community of Helena has an extremely high rate of interpersonal violence. We know that substance use is exacerbated by perinatal mental illness. We know that our child abuse and neglect rates are highest amongst our babies. So I just want to kind of put all those like considerations on the table when we think about who we're hoping we can support with this work. And maternal mental health has benefits because people know what that means. Perinatal is more sciencey. Melissa Bangs liked parental mental health, but that could be generalized to like making sure that we're surviving our teenagers. So let's talk about those words and see if we can't land somewhere. Seven minutes started. Let's hear it.
You know, I am sort of, that's the one thing that I got stuck on when I was thinking about these questions is, okay, what language are we going to use? Because language is everything sometimes to people. I'm either leaning towards maternal mental health or parental mental health, the idea that it encompasses the family, you know, both mom and dad. And I guess that's my thought.
Yeah, I'm hearing Greg in the back of my mind reminding me that we don't only serve mamas, and how can we be really thoughtful in our language to make sure that we aren't excluding everyone, or not everyone, but excluding people, especially dads. when we think about this work, and whether it's mental health or what I know we've used the words well-being as well in our maternal mental health strategic planning.
I think for me also parental is just also not gendered. And that's something to keep in mind, that even if someone births a child, they may not identify as a mom or a woman. And so it's definitely more inclusive to use the word parental.
I agree with that as well.
Out the words mental health versus wellness versus well-being.
I think one of the things that I worry about is if we talk about wellness, that, I mean, wellness encompasses everything, yes. But do we then sidestep the issue of mental illness and mental health, because that becomes stigmatized? And I know that this is a big thing for NAMI, not that they're involved with this, with our group in that way, but they are really sticklers. They don't like the word wellness per se when they're talking about people's mental health or the fact that there are mental illnesses in the world, you know. And we have to recognize that the illnesses I work with women who are in the perinatal period, or men in the perinatal period, they have diagnoses. They're, you know, anxiety disorders, panic disorder, bipolar disorder, major depressive disorder, postpartum depression, postpartum psychosis, and they have names. And so I do want to think about that. If we just look at wellness, are we just adding to the idea that we don't want to talk about what can really happen for women? So that's my thoughts.
When I hear wellness, I think of goop, which is maybe not the goal. I don't know. That's my thought. When I hear wellness, I think of like the wellness kind of like industry and not actually like health and well-being.
Could we say like mental health and well-being? Or is that too long?
The word recovery is used in this world sometimes. There's recovery that can happen between a bond that's been ruptured. There's recovery, you know, that can happen between couples. A bond for the baby, a bond between the couple. There's personal self-care system, or, you know, your internal work and recovery. But recovery is sometimes tied with substance use. So that's kind of another one.
Sarah Beth is saying, I like parental mental health and well-being.
I was just gonna say that too. I could go with well-being or not. I do like parental mental health for sure. Well-being, you know, it does make it a little more broad, but it's better than wellness, because I agree. Wellness just takes you all over the place. So I guess it's just a question of, do we want to keep the focus really on mental health disorders, and, you know, really be poignant about that, like Daniel was saying, or express well-being as well. I mean, it all comes together, right? It's all part of the same process, really.
I think like what comes up for me, if we like exclude the well-being portion, just like if we excluded the mental health portion, is like there are pieces of this resource guide that are not like mental health focus. I mean, it all contributes to positive mental health, but you know, like the acupuncture and the massage therapy, and I think it just kind of like emphasizes that it's like a holistic like umbrella of care versus just mental health.
That makes sense. Yeah, thanks for saying that. That speaks to well-being as well as mental health for sure.
And I agree that that we do need the idea that the resources that we are vetting might not be just traditional, you know, psychiatric services, counseling services, but other types of modalities that we know can be beneficial for mental health, or even, you know, and are used in the treatment of mental illness disorders. So
my concern when I think about the word parental, and I agree, I like it, is how do we hone in the age range that this guide is for? And so I was playing in this title down here, if we're a little bit more like descriptive in our title, perhaps we could avoid, you know, a mom who has a teenager struggling for support in that area, perhaps. I'm getting a thumbs up. Parental mental health and well-being resources for new expectant parents. I mean, I guess we could, like, what I'm thinking we should do is like keep this, if everybody's okay with that. And then perhaps we could come up with some sort of really creative way to continue to work on this kind of subject, unless somebody's got a couple more words we can plop in and move on along. Any more kind of key words? Newer expectant families is lingo. I think that's being used currently in our community for promotional promotion of the home visiting work. At least we used to say it that way. I wouldn't expect it's changed, but
Yeah, Bree.
Nice to use that language.
Yeah, Bree, I think that's the new or expectant families, I think is really good, because it also, because my concern with parental is that we kind of would maybe alienate, like, you know, like other caregivers that might be like foster parents or might be grandparents or, you know, other types of caregivers. And so I think adding the families part, I think is really great.
Okay. Any more feedback before we move on? Right on. Okay, let me get my timer back up. All right, so how do we hope to deliver and distribute this guide? I don't know that we're going to need to think through this that deeply right now. What I'm going to do is brief the group on the plans right now, is because this is staffed. This guide is written for Christina in Great Falls to bring back to her group. And Christina, I'd be happy to share this document with you. This group is for this toolkit that we wrote is for any new group, maybe with no staff or capacity to do this work. But because we're lucky and we do now have some paid time to do this work, this will be easier to do because we have help. And so, but we do want to decide like where we're gonna like work to distribute this stuff, and know that there's some help around this. But do we want to print a guide? Where online do we want this to live? Do we want to print a guide, and do we want it to also be online? Will we hope to see this guide in all of the doctor's offices? Will we hope to see this guide where parents meet, such as La Leche League Helena or childcare centers or other places that families go for services, perhaps Montana Legal Aid? Well, you know, so we can kind of talk about this, but I don't think we need to go really deep into it, besides just trying to come to an agreement of if we want it in print and or online or both.
I think personally, I think both would be ideal. And if we had kind of a practice of continue updating each year, making, if there's any changes, double checking that everything's accurate, and then making changes online and reprinting a certain number of them, but always making sure that that online version is the most up to date, because that's one of the things we see with a lot of the mental health resource guides that we print, like through the LAC and other groups, is that things do get outdated pretty quickly. And so we do want to have a kind of practice of reviewing and updating and redistributing, and having having it online as well makes it so that there's always the most up-to-date version somewhere.
Yeah.
I think somebody's gonna say, I was gonna say one thing that could be interesting is because we have a lot of the screening protocols already printed, it could be interesting to find a way to somehow package those together when we're distributing, like particularly when we're bringing to providers, if there's some sort of clip or pocket or something that we can add to include these resource guides. It could be really helpful because they do kind of go hand in hand to make sure that we're accurately screening, diagnosing, and then treating.
I agree. That was always kind of my thought too, is like, we can't have one without the other, because that'll help those providers that don't feel comfortable implementing universal screening because they don't have places to refer, have a tool. And then it can also help us identify places where screening could be increased. Okay, so, and as an example, just some historical context, the first guide that Roots did was a beautiful co-branded like little publication that had a bunch of advertising buys in there, and it was kind of like a little magazine. And the feedback was just like Jacqueline mentioned, as soon as it was printed, it was out of date. And it was kind of expensive and a bit of a burden to keep that going. And so they opted for a two-sided trifold the next year with a very robust website. Because what they lost by having a two-pager was the ability to really give good descriptions of the providers. And so now they do all sorts of local promotion of their providers that are included in their guide, but it's really just something that any office could really affordably print off their printer. They do some nice ones that are like water resistant, but it's a document you could print off at your office too. Does anybody have any other input for this piece? Haley, are you trying to speak?
Oh, sorry. I think if there's one thing to consider about, like, if you're printing it off the internet versus having a printed version done, is like when you print it off the internet, is it like not using a ton of ink? Is it not in color? Like it might be that it looks different than the version you all get printed.
That's a good idea.
I guess one other thing, Bree, and I don't know if this is the place to bring this up, but is accessibility, and making sure the document is accessible. And I don't know a ton about how the best way
like
to
disability?
do that. Mm-hmm.
Yeah.
Mm-hmm.
I know there's the word to describe this, but I don't know what it is. Access online. I don't know what that is, but I know what you mean.
So I can use with a screen reader and like all those different those pieces. Megan might know.
This group just got some training on making documents accessible, so I can definitely try to support on that. I think it's a little more complicated once you get into the PDF world, but there's definitely resources and I can assist on that.
Wonderful. Okay, so are we comfortable as a group to make a goal that we update a print version annually and we work to keep our virtual version current as well? Or do we want to just have one push once a year where we then update virtual online and we update the printed copy, and we're just clear that if there's that there's a process to get in next year? What do you guys think?
I think it would be really tedious to have to update things as you found out there were changes, and maybe if it's like a quarterly update online and then an annual push for changes. I don't want to get too in the weeds on it, but just constantly changing something online might be difficult. But if it happened quarterly, and resource guides I've seen in other communities will sometimes put the month and the date that it was last updated so people know when that last occurred. We have some county resource guides that MLSA and the state judicial branch do, and we have to do that on those. I'll link it. They're not the greatest resource guides, but the last time I brought them up at these meetings, people were amazed. Our AmeriCorps do them every year or two, and it's just organized by county.
Thank you. Dana, you look like you're going to say something. No? Okay. I think, like, for now, a goal would be the annual, and if we can improve our if we have capacity to keep it updated more than once a year, I would be really surprised as a task force. Perhaps we can continue to find staff, or perhaps once we really know how much time Megan and hopeful future Vistas have, we could make a more intense goal. But I think that would be, I don't know, I'm comfortable with that, but I wanted to see what you guys wanted. Annually, thumbs up, keep talking.
Yeah, that's good, Bree.
Okay.
You're right. I mean,
Okay.
Unless we got maybe like, communication that this person is no longer here at all, and it leaves a big hole in our resources, and there's another one to replace them, then, we could potentially go into the document, at least online, and make an adjustment. But I think like an annual review, like active review, and then if updates came to us more passively, then we could probably take care of those.
Okay. And I just want you guys to know that I'm hoping that someday I can get some sort of sweet grant that would provide capacity, and that was somebody's whole job, to help communities with the administrative level tasks required to do this stuff. But I don't have that right now. So I'll keep on working at it. Okay, so next question. We're doing great. What are some core characteristics you'd like the guide to embody? So we're talking like visually now. User-friendly, catching to the eye. Do we want it to feel calming and healing versus vibrant and poppy? Like, what's kind of the design kind of feel that we're hoping when a person looks at this guide? Like, what do we want them to see?
Like a hug, like it feels like a hug. Do you know how to do that?
That's
I think
great.
Megan does.
Megan?
Megan?
No, Emily's the designer. We already determined that.
Okay. A hug on paper.
That's great. I totally agree. I was thinking warm, comfy, healing, blankety.
Blankety. How about this? How about cool colors or warm colors? How about like like if you went to the Target section for babies, or we're gonna see like turquoise and orange and like salmon and like, you know, kind of modern-y, or are we wanting things that are like, looks like water, or looks like fire? Do we want babies' faces on this, or do we want patterns? Do we want flowers, or do we want clouds? I don't know, I'm just being kind of a,
Yeah, I mean, thinking about the potential population that we're reaching and maybe like the place where they are with their pregnancy or being a new parent, I think some of the things that we might think of or that are more mainstream, like used to target them, might not fit, might not actually meet them where they are, like those bright modern, like maybe it is more soft. I don't know. I think one of the things we've talked about is, you know, not wanting to, and I think I remember this when we were doing our visioning and stuff, not wanting to kind of shut people down by like the idea that it's supposed to be happy or look a certain way. And so trying to I don't know that I'm doing it in a very articulate way, but trying to translate that then to like the design. Most of what we see if we went to Target into the baby section would be like this idea of this happy, perfect coming home and experience. And that might not be, it might not land with some folks.
And also, Jacqueline, like depending where it's placed, it could then blend in with those other usual baby books that maybe they're ignoring because they're like, I've learned enough about parenting, like stop telling me how to raise my child, right? We need something that will stand out as, oh no, this is actually a resource for me. It's not exclusively about my baby.
As I think about the responses we got on the survey, we all know that local nature, people love being outdoors, maybe just nature tones. I don't know. Outdoorsy, I don't know. If there's some comfort in that, some comforting, peaceful outdoor settings, I don't know. Just a thought, throwing it in there.
I like all of the ideas. I also wonder sometimes though, and not that it shouldn't feel like a hug or comfy blanket. I just wonder sometimes when a mom is really struggling, or a father, you know, when they're in that deep, dark place where they're like thinking, you know, do they want something that looks so cheerful? Because then they might say, well, that's not me either. I can't connect with like the traditional kinds of things. So I just want to put that out a little bit, not to say that we can't have all these other things, but can we also look at, sometimes if I'm in my office and I'm handing somebody a guide and they're just in not the best space, you know, they might think if it's too cheery or too something, they might say, well, this isn't for me.
mm-hmm.
I don't know. That's just a thought.
I think that's kind of what I was trying to say, Dana. Thank you.
I remember, it's funny that I run the organization that does Purple now, because I remember when the first Purple video that the center produced actually showed like this. And I remember I was so anxious and traumatized already that when I watched that, it added to my visual loop that was already happening, and it was really bad. So I remember, because then I would imagine myself doing, like, it was not helpful. So I think whatever we do, we just be really mindful that women could be very visually stimulated at this point in time. And so perhaps nature scenes or something that's not humans could be helpful because they're not gonna integrate it into their vision, perhaps.
Yeah.
Go ahead.
Oh, I was gonna add, when you were kind of brainstorming, I was thinking maybe not babies, maybe not a baby on there or kids.
What if we're kind of trying to characterize and embody this feeling that we're assuming that the parent who is looking for or receiving this information is feeling? What if, like, I don't know, tell me if this sounds like, what about like a rain cloud, and then like using those tones, and then potentially like maybe at the end of the guide where the resources are listed, maybe like the sun peeking out from the rain cloud or something, like, you know, just kind of symbolizing that dreary, heavy, weighty feeling a little bit. And then like hope coming towards the, I mean, I don't know. Is that too like woo-woo out there, or?
I think using the natural elements is kind of a nice way to connect everybody personally,
Right.
but I'm into that stuff.
And maybe we're just thinking about it, what if we were to think about, you know, this is our guide of Montana, you know, we really pride ourselves in the state of our use of the outdoors. So maybe it could be something specific to a Montana scene of nature, even if it were incorporating, you know, some stormy things and sunshine at the end. But maybe we could really look at it specific to what we really are proud about of our state as far as the outdoors.
Yeah, I think that's a great idea, Dana, because then you're able to show the beauty in things that are gray and rainy, because I think what you'd want to avoid is something looking like a stock photo of depression, right? Where it's just rain on a window, because sometimes that can just be used poorly. Whereas what Emily just is describing is like a really great way of showing that sort of hope. And so maybe embedding Montana gray skies that you're like, actually, that's gorgeous, is a good call.
Great. So this is, let's see, we're doing really well. So I'm gonna, I think, let me count. Where are we at? We've done, I'm gonna move your faces really quick. Okay, 1, 2, 3, 4, 5. We're doing well. Okay, so I'm gonna let us go on this for just a few more minutes because I wanted to remind us that we do have access to the infographic that we designed, that is the 2-pager with the kind of the maroon color that we could switch around. It does have people, it's not, I don't know if it'd be helpful to pull it up right now and share it, or if you guys remember, but what I was thinking we could do with this, I really like this, and we will be, obviously we'll have a web page for this. And so perhaps if we decide to, if we don't make a whole new design for the 2-pager and decide to use what was created, which I'm not attached to doing that or not, it's just a tool that we could use or not. We will need to think about the look and feel of a web page and where all this lives. So this could all kind of theme into what our website or web page for the resource guide looks like. But would it be helpful if I pulled up the 2-pager right now? Okay, let me do that really quick just so we can keep going on this. Bear with me. Okay. Okay, so this is what we have right now. So the vision was to have this on one side of a document as a teaching tool. And then all of our resources on another side of the document. But we, of course, can do whatever this project evolves into. We were on a bit of a time crunch to spend some earlier funds down, and so this didn't get as much kind of interaction as we'd wanted. I think that the feedback we got from the Flathead was that it was too like I think the pink made it not as like parental mental health. It was more maternal mental health feeling. So I know that the Flathead changed it to green. We do have like a dad and some pregnant ladies and stuff, but there's certainly room here to think about colors or changing or scrapping. But I just wanted to bring that back into our discussion to see if we wanted to keep talking about look and feel, or if we wanted to move on.
I mean, I think that we've gotten some good ideas about what we want it to look and feel like to a certain degree. It probably would take somebody spending a little time playing around with it. I do now that it's in front of me remember this, and I liked it. I liked the information. So maybe if someone took some time to look at it through the lens of what we just discussed.
And see if they can't update it with some of those parameters.
Mm-hmm.
That sounds good. Any other feedback?
Yeah, I like that. I like Jacqueline's idea because I liked the initial setup of this, but maybe thinking about colors and things like that, some of the things we're talking about. And also I think, we know that you have the thing that PMADs can affect dads too. I think Harley's point though, that to not be too gender specific in this, because we know that it may be different. Especially if anybody had the opportunity to hear the speaker last year in Portland, who was, a transgendered male who gave birth, and that was an eye-opener for me as a person. And I think I'm sure that there are people here in Montana, they're probably just not out there in the open the way women with traditional, women who are pregnant, but we need to think about that being inclusive somehow, making sure it isn't so gender specific or so sort of what's the word? So sort of traditional, like we're just looking at traditional families, mom, dad, children kind of thing. So.
Great. Okay, so this was a good one, and I'm going to just summarize really quick, and then we can move on. So we are thinking we're going to have some sort of nature theme, perhaps using weather changes in Montana look and feel to, some of the changes that happen and how beautiful they are here, kind of be the spirit of the design. We're gonna use the 2-pager content, but hopefully overlay what our community is envisioning right now, and that will tie the 2-pagers to the look and feel of the website. And we're going to be careful that whatever we put up there is inclusive and not too gender specific. Does that sound good for now? I have a feeling that when we get there, we're going to need a little design subcommittee to work this a little bit deeper, and so we'll make sure to come back to the group and get some volunteers for people that like working in this space. Okay, we have almost a half hour left. How's everybody doing? Do we need a second, or are we gonna keep on going? Good? All right. Okay, what else might you like this guide to accomplish? So, all right, so the point of this question is, and then I can like read it through, but really like when you, there's a saying for this, but like whatever you document or whatever you study, that becomes more important, right? What we measure, we value. When we have a specific maternal, perinatal, no, parental, hold on. When we have, what's my last name again? When we have a specific parental, mental health, and well-being resources guide for new and expectant families in Helena, that will create a space because we value that. And now we're doing work and putting energy to a project. And that's kind of like where the spirit of this question comes from. So like, besides having a tool for a nurse who just screened a client at the Meadowlark site, or a home visitor that just, you know, identified a mom in a house and she or he has a form to pull out of their bag to go over, or something that you picked up in your new pregnancy packet from Dr. Huntley. What else is this guide gonna do for us? Like, and what happened for example in Bozeman is that their guide has grown and it's created this inertia towards getting more training, because we're going to get into this later, but there's criteria to make the guide. And so it's created more trained clinicians. It's created more awareness of the importance of educating women and families about perinatal mood anxiety disorders. So that's kind of the spirit of this question, is like, what are we hoping happens besides just this basic like resource guide? So Mela wrote, and I kind of edited, was make it easy for professionals to be thoroughly familiar with PMAD resources in our community, become the organizing hub for PMAD resources in our community, empower providers in a multitude of settings to feel comfortable screening for PMADs because they have referral resources right at their fingertips. So personally, I'm hoping it does increase screening. Awareness.
I think decrease stigma community-wide, but also increase different providers, not just medical providers, service providers in our community who work with these populations, to feel more comfortable to ask about this stuff or talk about this stuff, because like you said, they have then something to do with the information that they might get from the person sitting in front of them. I know for the WIC staff, they are now required to ask certain questions, but they still struggle with it because they don't feel like they have, if someone says yes, then what do I do with it? I don't have a good next step for someone.
Okay, I agree. And I think that discomfort is a system issue that I'm glad you brought that up, because I can pick on nurses. When closed or leading questions are offered during assessments and screenings, it can really change what a mom is comfortable with sharing. Like, you're not drinking, are you? Or, you know, everything's going okay, right? You know, like, no, but I'm not saying no now. So like, but I think that's because the nurse or whoever's screening doesn't know what to do. I love you and you have to go. Okay. So decrease stigma, increase screening, promote, like what, build workforce capacity? Does that, do those words have meaning to everybody on the call, or should I say that a different way?
I like that.
It makes sense.
I think another part is to justify the need for increasing the workforce as well. So once we know kind of what's available, then being able to identify those gaps and really encourage the workforce to grow.
Yeah, and that's right, Megan. When we first started this, we were like, well, let's just make a guide. What year was that? Like, geez Louise, 2018, something like that.
Right.
And there was, I don't know, there was hardly anybody. Dana, Pam, who else? There's not very many people that had training then. So we had to pull back and train. So that's true. And I hope that in Bozeman on their website, they have like a contact us form on their website. Like if you didn't make the guide this year and you want to be part of the guide next year, contact us here. And so they can, when people provide the service, but they're not in the guide, they can self-connect to this initiatives. And then that would be a great place. Maybe this could build participation in the task force.
I like that. And I would also say, and maybe this, I think this has just already been said, it's not just a resource guide. I mean, like you said, Bree, when we started this 3 years ago or so, that was kind of, we were just going to make a resource guide. But then we realized that the task was bigger than that. And it really is broader than that. Again, I go to that word. But I know that there have been other resource guides in this community, for mental health and for, other kinds of issues. I see this being a place that we are the organizing hub, that we're going to maintain this, we're going to keep it up to date. We're going to take, we take a value or a vested interest in it as a guide. That it's not just simply a guide that somebody puts together and throws out, because, I just saw a guide, unfortunately, and this is nothing against NAMI, but a guide that NAMI has that is totally out of date. They have people on their guide that haven't been in practice for a number of years. There's a number of resources in that guide. I mean, when I looked at it, I was like, wow, they're not vested in trying to keep it up to date, trying to maintain who is really active in the community, who are our providers in this community. And so I think that has to be sort of our goal too, that there's that vested interest to keep it up to date, and that it's meaningful, that we take that interest in making sure it lives beyond me.
Yeah.
Well, and I was going to add, and I think people have kind of said this, but just to emphasize the need to educate, not just to educate folks around what resources are available, but really to educate, and normalize the prevalence, and that the basis that there really is a need for such a resource directory because of what we know, is out there and not being met. So I don't know if you would,
I think that's great. And I'll bring back Emily's point of like building like advocacy within family members, just to advocate for care for those that are struggling that might not be able to help themselves. So.
Bree, I feel like I'm late to the conversation, but
hi, Jeff.
It is hi. So the printed guide and an online guide both, right?
Yes.
Is that correct? And so when you ask what else you might like this guide to accomplish, I would think if you're putting it in the hands of people in crisis at that moment, when you go back to those feelings of it being a hug and all those kind of things, you know, what you want it to accomplish is that it's user friendly and it's kind of welcoming. Like it asks some questions at the beginning that draw the person in. That it's not just, you know, in your face with statistics or resources, but kind of has some touchy-feely entry level type stuff that then draws them into the information. Does that make sense?
It does. Yeah, it does. A couple other things that I think like this will do is, well, I've heard, you know, so recent, you know, my two recent hires have been people that are new to this conversation and this way of working. It's coming in through more of the arts community, I think I could just say. And Emily, you're still on the call, but both Emily and Claire said it just is so cool to know that this group exists and there's actually people that are meeting to think about this together. Like, and I never thought about it like that. And so to know that there is community organized, like to be the hub and to let moms know that there is a group of people that care enough to do this work to support them was a comforting thought that I've heard expressed, and I never thought about it like that before. So I think like helping decrease like the isolation and shame will make to know that, oh, if this problem's big enough that a whole group of community members are organizing to support, that could be helpful one. And I think this is going to prevent bond disruption. I mean, I really think if we can get this in the hands of child protective service workers, like we might prevent some removals even. We might actually like promote attachment and reduce family, you know, trauma. So I mean, I kind of want to put that in here. I think this guide will accomplish keeping moms and babies together when they should be. I don't know what you guys thought about that, but I can just put promoting attachment. Preventing.
I think putting that we want it to help to keep families together is a good fit, Bree.
Okay. Anything else on this one? That's good. That's good goals.
I did have a question. I thought that Jeff brought up an interesting point when he said like to maybe have a question or something at the beginning to draw a reader in, and just kind of going back and thinking like, who are we trying to reach with this guide and what type of questions might we ask to prompt them to look a little deeper here? What would those questions look like?
That's a great point. I like that. Yes, we need to look at that. We need to, I mean, I don't think it's something we can really think of. Well, maybe we can think of today, but right. That's a great question, Bree.
Well, one of the huge responses on our survey was this parental feeling of inadequacy, just in general. Like, I'm not equipped to do this. You know, and that's 0 to 5 in general, but, you know, early on, it's like, where's my instruction manual, you know?
Mm-hmm. Yeah. Well, and like for first time moms, I can't tell you how many times it's been like, oh, I read all this stuff about my pregnancy, but never kind of how to get sleep. And now I'm too tired to read that book. You know, like you forget that parents can't learn the same way when you have a newborn at home. Easy access and all. Okay, cool. Cool, cool, cool. All right, let's see. We're getting through this. I firmly believe we'll be through this on our goal. That is awesome. Okay. So this is going to be a good one. So I'm going to set our timer. What core values do we hope this guide can also tackle? Include elements that tear down stigma, shame, and isolation. Elements that educate about the symptoms and how vastly common they are. Include a core message that taking care of yourself is taking care of your baby and that they are not alone, not to blame, and with support they can get better. They will get better. Empower parents and support people to get the help and care they need and deserve. All the above, check, moving on. What else?
I like what you said earlier about there is a whole group of people in this community that care about them and are thinking about these things. And doing work to, you know, grow that community of people, or group of people.
Okay. Okay. Thanks. Thank God for grandmas. Thanks, Mom.
Also, you should go outside and work with Omar, but he's can't respond.
Just so people maybe didn't see, but Robin, who was having trouble with her microphone, she said, there are not good or bad babies, not good or bad parents. And I think that's a good message, a core value. Like, this isn't about being good or bad, anything, you know. So I think that's an excellent thought.
I feel like that's definitely something worth saying, like in the guide even.
Mm-hmm.
If I was struggling, I would want to hear that.
I think something cool about our task force is the fact that we have in our vision statement offered acceptance of all paths to healing. I kind of forget how we wrote it, but I like knowing that we accept parent choice and their healing, and you know, certainly know that there are best practices, but I think that's really neat that we set that as a value. I think that was an inclusive decision that we made, and we might want to, I think our guide, by listing like some complementary healing modalities on our guide, will help describe that. But I certainly know from personal experience that it took me a long time to feel ready to take a prescription. I took other things first, not working. Nice.
Those are the values from our strategic plan. So.
Okay, I'm going to put it in here. Our values include compassion, empathy, respect, such that people feel seen and heard, listening, self-determination, individual and unique stories, investment in mothers and families as an investment in the future, pregnancy as a time for change and education. And I think our mission is like a holistic approach to, we have the word holistic in our mission statement.
Right, we do. And I like that. I think that communicating our values that way, I think that would lend something to the guide, and maybe in a unique way.
Okay. Anything else we want to add to the core values that we're hoping gets relayed in our guide?
Maybe inclusivity, make an effort and intention towards inclusivity.
Okay. Anything else? Okay, cool. We're continuing on. We have 15 minutes left together today, so let's see. Do we hope to provide resources for prevention and wellness? I think this is a good time to pull up the back side of the template that Healthy Mothers, Healthy Babies made as an example of what we thought would be helpful. Oops, that's not it. All right. Bear with me here. All right. Okay. So page 1, page 2, we had, can people see this okay? I'll zoom it out a bit. Okay, so this is, as we think about the question, which I'll read it again and then I'll put it back up. Do we hope to provide resources for prevention and wellness and recovery after the crisis? So then back to some of the areas that we thought perhaps would be a way to break it down. We've got, home visiting, fatherhood, doulas. We've got mental health providers, counselors, psychiatry, any specializing in working with dads. We've got medical providers, family practice, OBGYN, pediatrician, naturopathic medicine, midwives. I think this isn't the final one. It doesn't look right to me. Anyways, you kind of get the gist. Breastfeeding support, complementary and alternative medicine, acupuncture, massage, Reiki, yoga, and then other resources. So as we just kind of think about some of the resources that I saw in some other guides, we popped them on there. So what do we want to do? I think when we started in a meeting several months ago, we started kind of going, we got really excited about this piece of it, and our list got really big really fast. And then we, in my kind of interpretation, pulled back and thought, okay, wait a second. Do we really want to make it kind of like a pregnancy and early childhood community guide? And because we know that that will lead to increased mental health, or do we really want this to be specific for people experiencing mood disorders? And so I know we called it wellness, well-being up above, but I think it's good to kind of just revisit this and really think through like how deep into community-based supports do we want to go into this guide versus And I want to balance that against this conversation that we're going to have as we continue to go forward, is this whole vetting process. And we need to think about, like, and we're going to get there, and I'll probably, I don't know if we'll get there today or not, but I might stop us and then start with that next time. But like, if we're going to have, say Dr. Hay, who's retired, I can call him out. Say Dr. Hay, who delivered babies for 30 years in Helena, never went to a PMAD training in his life, but he's worked with women for years and years and years. And then we have an up and coming therapist that has been to every single training, but maybe has only worked with moms with PMADs for a couple years. Like, how are we going to make those decisions as a community about who makes the guide and what that looks like? In making those decisions, there's also going to be other people that come up, like a postpartum doula, perhaps, or like a childbirth educator. And so how are we going to, as a community, like, how deep within this community supports are we going to go? Like, perhaps there's a mom group that happens at X Works, you know, like, is that going to make the guide? Like, how? So we really need to think about what this guide is for and what this guide is not for. And is there a place where all these resources are being gathered in another place that could be a complementary handout, and this is really for this specific problem? Or are we really just supporting our community of new parents with this guide?
Well, I do think we need to have sort of an end. I mean, we can't include everything. You know, it's like when you go to graduate school and you want to, you know, have this thesis that's so broad, and your instructors and everybody have to narrow it down. I mean, we can't pare it down to nothing, but we can't. I think we have to realize that there are probably those resources, like maybe a mom's group, that might not be, that doesn't fit for our guide, that wouldn't really be appropriate, or not, I don't want to use that word, but really isn't for what our goals are, but would be in a different guide, you know, because there are a lot of other guides out there in the community for resources that people are trying to make. And there's, you know, 211 Connect, and there, you know, there's all these different things. And I think we have to have a stopping point for sure. And I think we have to, it isn't that we can't have, you know, doulas and alternative medicine and even, well, if we have a peer support group specifically, you know, if by the time we get this ready to go to print, that there's a peer support group going that we can, you know, put in the guide, I think that would be important, because it's peer support for, it's not just a mom's group per se, it's actual peer support in some way. So just my ramblings.
And we have the vision that those peer supporters would be users on Connect and be able to make those connections to those other resources. So that's a good point, Dana, and maybe that's our, but I was trying to think of like a larger kind of service or group that then they could get connected to a lot of other things through that.
Right.
Mm-hmm. So, because I think of like a couple things, such as, you know, what do pregnant women do to stay healthy? You know, what do moms that have just had babies do to stay healthy? Like, I can't even think of it right now because my brain's tired from facilitating, but who knows something that moms do to stay healthy? Like, let's get a real life example here. Like, after you have a baby, what do? We might go on, do we have a hike it mom here anymore?
I don't think so.
Do we have any, you know, like, I'll say ULA, because I love ULA because my sissy made it. And also, I know a lot of moms use it, but we don't have one anymore because the load is closed. But, you know, moms will go dance together. Like, do we include something like ULA? Like, do we include Is there a prenatal yoga class in town? You know, like, I think that's kind of getting to these questions. Like, is there some sort of moms and strollers exercise walking thing that's going on? You know, like, are we going to promote that as self-care and list in this guide? Do we want to do that?
I certainly think those pieces are incredibly important to have out front, because sometimes we go, I think, maybe way too mainstream, you know, medical
Right.
things you need, you know, things you need insurance for. And as we know, you know, as we're looking at a comprehensive wellness, especially in that vulnerable period, super important to have those, the awareness of those resources as well. I think, my 2 cents.
So how about this as a filter, like, not necessarily just for women's health in general, like not necessarily interconception care, but like pregnancy and postpartum health focus. Would that be a good filter, a good stopping point to kind of weed out some of these community activities that are awesome? But like, let's talk about books and babies at the library if we ever, you know, get out of COVID.
Right, that's a great.
Would that fit in our criteria?
See, well, that's an interesting question, because I see, you know, it's a great resource, and I try to, you know, recommend my moms when it was going on for them to utilize that. But is that really about our resource guide for what we're, you know, for, I mean, it is for wellness, or well-being, yes, but would that be better placed in a different guide or a different area of the community resource place?
Yeah, I mean, I think that stuff could maybe be added to our ECC calendar on the website. Like stuff that, but if there are resources very specifically for, like you're saying, Bree, like perinatal and specifically, it's hard, but I think if it's something that's kind of open for anybody's experience, you know, anybody's experience versus someone maybe who's struggling and needs extra support, and if it's a consistently scheduled thing, we could put it on that calendar for the ECC website, because that would be something that any family or parent or caregiver might look to, and we could put that on the resource guide for like activities kind of stuff. But then if it's like a service, maybe if it's like a service delivery for that specific target population, maybe that's the type of criteria. Is that making sense?
I like that idea.
Yeah, I kind of agree with Jacqueline, and
I think this is gonna be a hard one, and social gatherings are contributing to positive mental health too. And like, it's hard to find mom. Oh, I'm frozen. Am I frozen?
No, you're good.
Oh, I just got a note that I was unstable. But maybe it looks like we're about done. Let's chew on this and start this conversation next month on this topic and think about it. Like, think about, is it important to help moms find where the other moms are so natural supports can evolve? And is that something in our guide, or is there capacity within the Early Childhood Coalition, which we're a part of, to do a better job about making that information available? And then we can link to the ECC website on our guide as a resource. So think about that, chew on that, and then we'll finish up our few questions next month. Thank you. This was super.
I think Christina had something to add really quickly.
Oh, thank you. Okay.
She got cut off a little.
oh, I was just, you know, saying kind of on the lines of Jacqueline and Dana, you know, when I think of this guide, it brings me back to my experiences where moms who are in crisis don't have the resources from people they're seeking out for help who are trained in these areas. And so when I think of this resource guide, it's to get it out to providers who maybe don't have those trainings and everything, to get just to that, at least the first step of connecting with someone who is knowledgeable in the area. And then, you know, as a second step, connecting moms with support and everything too. But I mean, I know that's kind of from a narrowed provider stance, but just seeing the lack of, you know, people coming and saying, well, there's no one in Helena with that experience that no one knows of. And so that's what I would see as this resource guide trying to help bridge that. So, and that was all I was saying. So.
That's great. I think this is good. And I really do think that we will uncover some really supportive things, and perhaps we can find another way to support promotion of it and keep our guide within its mission.
Okay.
Okay, well, wonderful job, everybody. Thank you so much for all of this strategy and vision. And Dana, I'll pass it back to you to close us.
For leading our group in this discussion. I think it was a really good discussion. I think we got a lot accomplished today. And I'm very excited about where we're going with this. This has been an important discussion to have, maybe one that I think we didn't realize that we needed to have before, as we were trying to figure this all out in the last 2 or 3 years, or even at the beginning of this year. So I think this is great. I think this will just make whatever end product we have really worthwhile and meaningful for the community. So thank you.
Thank you, everybody.
So I'll let
Thank you.
Okay, thank you.
Thank you.
Thank you. Thanks, Bree.
Yeah, my pleasure. That was fun for me. Thanks, everybody.
I'll see everybody next month.
Thanks, Dana.
Thank you.
Yeah.
You guys have a good day.
Yeah.
Bye.
Can I get out of it?
I'm trying not to end the meeting because I want to check and make sure I have everything. So
Trying to like get out of here. There I am. Okay. Bye, Dana. See ya.
bye-bye. All right, so. Get this.